Hello, I'm plastic surgery specialist Kim Sun-dong from Sun Plastic Surgery. Ptosis correction is a procedure for those with sleepy or droopy eyes. It doesn't necessarily target the thickness of the double eyelids. Rather, it's a procedure that concerns itself with the pupils and the inability to open the eyes due to weakened eyelids. Ptosis correction will help with opening one's eyes. There are two methods for ptosis correction, one being an incision-based one, while the other does not rely on making an incision. Ptosis correction is a procedure that shortens the eyelid muscles from inside the eyelid. So in order to do it, we'll have to make an incision right outside of the skin, open it up, and continue with the procedure from the muscle inside. Back in the day, this procedure was performed alongside blepharoplasty, but nowadays, there are non-incision ptosis corrections that are available. This method targets about the same muscle, but instead, we do not cut up and tie the muscle from upwards, but from the inside. This shows that non-incision ptosis correction is possible without blepharoplasty. I recommend ptosis correction to people who have to deal with heavy eyelids. I also recommend this procedure to those whose pupils are much less visible due to weakened eyelid muscles. Here's something I'd like to tell you. Some people don't actually recognize whether or not they have heavy eyelids. Most of the time in cases like these, people would cover it up by opening their eyes a bit more or by lifting the eyebrows. In cases like that, if you have a strong impression, or if it takes more energy to open your eyes, it could mean that you have heavy-lidded eyes. And oh, if you lift your eyebrows a lot too, that could also mean that you might have heavy-lidded eyes in cases like these. The best course of action, really, is to consult a specialist and find out whether or not you need ptosis correction. There really aren't any particular precautions to take. Most of the time, there won't be any problems. Very rarely, there are cases in which people can't close their eyes, and in that case, ointment or eye drops would have to be applied in order for the eyes to get proper protection during the recovery period. As I mentioned before, there are two methods for this specific procedure. The non-incision method would not leave a scar at all. On the other hand, if you choose the procedure that involves incisions, you'll need to get the stitches removed as per usual. The process is identical to blepharoplasty, so you'll have to remove the stitches after 4 to 7 days from the procedure, and it would leave the same scar similar to blepharoplasty, though this varies from person to person. But once again, the scar would have the same appearance as an incision blepharoplasty. When it comes to the possibility of revision surgery, this procedure really isn't any different. But it's not exactly easy to know the exact possibility of ptosis correction. So, if the eyes should be pulled more after the surgery, which means more correction is needed, we do the correction again. And if the eyes are overcorrected, then we can do the surgery to lower it. The recovery period differs for incision and non-incision. For non-incision surgeries, the recovery period is quite short, simply because we don't perform blepharoplasty during that. If only the ptosis correction is done, the recovery period is once again quite short. Just after 2 to 3 days, it doesn't look obvious anymore. For incision-based ptosis correction, the recovery period is similar to that of blepharoplasty. Undercorrection, overcorrection, and lag ophthalmos are the 3 common side effects. Undercorrection, meaning that the correction that was done wasn't enough, so the eyes are not as intense as expected. In cases like these, we pull it a bit more. Overcorrection, on the other hand, means that the eyes look too intense. For this kind of situation, we can make the eyes look better by doing a revision surgery. In lag ophthalmos is when the eyes won't close. It's not necessarily similar to overcorrection. Lag ophthalmos sometimes happens. In the event that this happens, you have to protect your eyes. But if it's too much to deal with, we can do revision surgery. Ptosis correction is a surgery with a lot of difficulty. We do this kind of procedure for people with sleepy-looking eyes. Recently, non-incision ptosis correction is more common, and the procedure has become relatively easy in comparison to what it was back in the past. In the past, we only did ptosis correction if the eyes were heavily sleepy eyes. But now, even slightly sleepy eyes can be fixed with ptosis correction. So if your eyelids seem a bit too heavy or look sleepy, or if you want your eyes to look more intense, you can get good results from ptosis correction. So, go and consult a specialist. Here in Sun Plastic Surgery, we specialize in eye surgeries, and ptosis correction is one of those surgeries. From slightly sleepy-looking eyes to heavily sleepy-looking eyes, we can perform the appropriate procedures. If you have sleepy, droopy eyes, come visit us and you'll get good results. So that was ptosis correction. I hope this video was helpful to you. We'll see each other again.
See you soon.